Mr. Nazarian will be presenting AB1801 initially, and then do you have the materials for your second bill as well? Perfect, thank you.
Thank you, Mr. Chair and colleagues, and thanks for accommodating many of the parents who have come here from other different reaches of the state to be with us today.
Absolutely, my pleasure.
So I'll just start presenting.
Please.
Mr. Chair and members, I will be accepting the suggested amendments listed in the analysis. AB 1801 would require the Department of Healthcare Services to establish a commission which would review and provide recommendations to issues surrounding exposure to cytomegalovirus, otherwise known as CMV. CMV is the most common infectious cause of birth defects in the U.S., impacting 1 in 200 infants each year. It can lead to hearing loss, vision loss, jaundice, seizures, developmental and motor delay, and other long-term health problems. Most infants at risk of CMV go unrecognized because they are simply not being tested. As a big problem as CMV is, only 9% of the population even knows about it. What we're ultimately after is trying to understand this virus more clearly and opportunities to mitigate its harmful effects through this bill. By creating this commission, California will gather the most contemporary evidence-based and data-driven information which can be used to make the appropriate policy recommendations in order to combat this serious virus. AB 1801 represents a first and important step for California to join this national trend. With me, I have Janelle Greenlee, a parent of 2 children afflicted with CMV and founder of the National CMV Foundation, and Iram Ahmed, an assistant professor of otolaryngology at Stanford University Medical Center.
Thank you. Please go ahead.
Thank you, Assembly Member. Chairman Wood, Vice Chair Mays, and members of the Assembly Health Committee, thank you for the opportunity to testify before you today in support of AB 1801. My name is Janelle Greenlee, and I'm co-founder of the National CMV Foundation. During my years as an advocate on this issue of CMV, I've met with countless medical, agency, and policy professionals nationwide and worldwide, and I've heard the same thing over and over again. Something needs to be done about CMV. Today in my home state, AB 1801 is that something. AB 1801 seeks to engage the appropriate and relevant professionals together as a commission to address the issue of CMV. This commission will evaluate the body of research with respect to CMV, newborn screening and diagnosis, and will also identify how best to educate women in our state about CMV. The state of Maine, all the way across the country, recently convened a similar commission to address CMV, receiving broad support from pediatric associations as well as their state's Centers for Disease Control and Prevention. Maine's commission included an array of professionals specifically experienced in the issue of CMV, which resulted in a very thoughtful and comprehensive report back to their state legislature for review. Additionally, several other states have already enacted CMV education and screening policies, and several more are working towards creating and expanding their existing CMV initiatives and programs. This attention and energy around CMV is accelerating as the body of research points to its urgency. We're finding that CMV disproportionately affects Black, Hispanic, and multiracial communities. We're finding that the cost impact of CMV numbers into the billions of dollars. And unfortunately, we're finding out that CMV is proving to be a significant cause of miscarriage and stillbirth. And still, we all agree, where I come from, that something needs to be done about CMV. In addition to my advocacy work, sorry, I brought a prop. I'm also the mother to twin daughters, Riley and Rachel. Riley is one of these lovely blonde girls in a wheelchair with the pink bow. We tried to identify her. They were both born with CMV back in 2003. After Riley and Rachel were born and diagnosed, my doctor told me that CMV was rare. Having never heard of it myself, I pretty much believed her. However, the Centers for Disease Control and Prevention reports that 1 out of 200 babies are born with CMV. So that means 1 in 200 babies will leave the hospital, and 1 in 1,000 will come back again and again and again. Babies like my twin daughters, Riley and Rachel, who each have profound hearing loss and cerebral palsy. Additionally, my daughter, Rachel, had profound vision loss, breathing issues, seizures, and a feeding tube. She was severely medically fragile, and she ultimately passed away in 2014. But Riley's here today I'm here today. We brought a lot of families and a lot of noisy kids today. And we want to ask for your aye vote for AB 1801 because indeed something needs to be done about CMV. And lastly, I want to thank Assemblymember Nazarian for helping to author this bill and being a great support to us. Thank you.
Move the bill.
Thank you. Thank you. Yeah, please.
Chairman Wood, Vice Chair Mays, and members of the Assembly Health Committee. My name is Iram Ahmad, and I come before you today to testify in favor of Assembly Bill 1801. I'm an assistant professor of otolaryngology, also known as ENT, at Stanford University, and I work at Lucile Packard Children's Hospital. I have a particular interest in CMV because I treat children with hearing loss, and CMV is the most common cause of congenital hearing loss, yet it has the least amount of awareness amongst not only my patients, but also my colleagues. We are not able to identify who has CMV as an infant, and we miss this valuable window of opportunity for diagnosis. As a pediatric otologist, a doctor who treats children with hearing loss and deafness, it continuously shocks and saddens me that we are not diagnosing this condition that causes such severe symptoms such as profound deafness. We are not bringing the necessary attention to CMV and increasing the awareness of CMV. Now, the reason this is happening is because this virus sheds early in the early months of life during infancy, and it cannot be detected later on. This means that a child who presents to my clinic with hearing loss at the age of 6, who is profoundly deaf, they will never know if it was from CMV. We end up working up their hearing loss with genetic testing, multiple genetic tests, CT scans and MRIs, all which come back normal. However, we do not know why this child has profound deafness. These children would not need this unnecessary radiation and contrast and unnecessary testing if their condition had been diagnosed in the time-appropriate fashion. This is a problem in identifying the infection, not because we don't have the tools to test for it. We do have the tests. It's because we are missing key steps in the timely diagnosis. The commission proposed by Assembly Bill 1801 is an important step at our state and its professionals begin to study and confront the issue of CMV. It's the most common cause of hearing loss in children. It costs our healthcare system funds, but it also costs significant behavioral, emotional, and cognitive impact in the future of our children. I support AB 1801. Thank you for your time.
Thank you very much. Others in support? And just your name and your position, please. So, thank you. Oh. Microphone, please.
My name is Marissa Seaman, and I'm from Sherman Oaks. I am in Assemblymember Nazarian's district. Thank you so much. I support AB 1801 on behalf of my son, who was born with CMV. This is an important issue. Please don't let our family's nightmare become another family's reality. Thank you so much for your consideration of this bill.
And thank you. And please, just your name and position, please.
Hi, my name's Debbie West, and I am from Assemblyman Wood's district, and I have a 32-year-old son with CMV, and I support AB 1801.
Thank you.
Hi, I'm Amy Fanta from Half Moon Bay, California. I strongly support this on behalf of my son, who is living a normal life due to early diagnosis and detection of CMV.
Thank you.
Eileen Greenleen, I'd really appreciate your support for this bill. Thank you very much.
Thank you.
Chris Mance, Auburn, California. Please support AB 1801.
Thank you.
Bob Mance, Auburn, California, in support of Assembly Bill 1801.
Thank you, sir.
I'm Pat Delmage. I'm a pediatric physical therapist from Napa, California, and I'm in strong support of this bill.
Thank you.
Peter Berry, a CMV researcher at UC Davis for 30 years. I strongly endorse this bill.
Thank you.
I'm Lauren Churchill. I'm here with my son Dylan, who was affected by CMV, and I strongly support AB 1801.
Thank you.
Spencer Churchill, also with my son Dylan, and we are in support of 1801.
Thank you. Thank you both.
Juliet Spencer from San Mateo. I'm also a CMV researcher at the University of San Francisco, and I strongly support this bill.
Thank you.
I'm April Rood from Napa, California, and I'm here with my 2.5-year-old son with CMV in support of 1801.
Thank you.
I'm Abby Bemit. I'm here from Napa, California with my daughter Katie, who was born with CMV, and I'm here in support.
Thank you.
Noah Torres from Stockton, California, and on behalf of my sister who was affected by CMV, I am here in strong support of AB 1801.
Thank you, sir.
Hi, I'm Dr. Seppi de Gilani. I'm Associate Professor of Otolaryngology at University of California, San Diego, and I strongly support this bill. Thank you.
Thank you.
Daniel Savino, Association of Regional Center Agencies. Regional centers connect individuals with developmental disabilities to state-funded services and supports. CMV can be a qualifying condition, so we're very much in support of this bill.
Thank you.
William Greenling, Livermore, California, and I support this bill.
Thank you, sir.
Missy Johnson on behalf of the California Optometric Association in support.
Thank you.
Nick Broke on behalf of the California Academy of Audiology in support.
Thank you.
Gwen Guest, Folsom, California in support of 1801.
Thank you. Is there anyone else? Is anyone in opposition?
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. We'd first like to thank the author and his staff for working with us, and we'll be removing our opposition.
Thank you.
Jennifer Alley with the California Association of Health Plans. We've also removed our opposition and appreciate the author's office for working with us.
Thank you.
John Winger on behalf of America's Health Insurance Plans also would like to thank the author and also remove an opposition.
Thank you.
Chairman and members, Barbara Glazer with the California Hospital Association. We do have an opposed position on 1801. Our concern is that the state would be developing standards that could potentially be different than the federal. We think it would be better if a nationally recognized organization such as the Centers for Disease Control came up with those standards so that we would have standards nationwide. Thank you.
Okay. So are you in opposition to the bill? Okay. I won't count the other one and then as a witness then, so please.
Hi, I'm Dr. Erin Platter. I'm a resident pediatrician speaking on behalf of the American Academy of Pediatrics of California in opposition of AB 1801. As a resident pediatrician, even in the last month, I have treated a premature infant who was severely affected by CMV, and I have seen many families devastated by this illness. However, and we applaud the committee for bringing all this data to light. However, research on testing for CMV is still in its infancy for infants. Testing all infants for CMV has been shown that sensitivities can be as low as 30%, which means we would still be missing 70% of infants who would be positive for CMV. The bill, as it's currently written, seems to support legislative policy change towards universal screening, and for that reason we are in opposition to the bill as it's currently written, although we are in strong support of committees addressing awareness and education for CMV.
Thank you.
Yeah, and hi, I'm Dr. Dean Blumberg. I'm a specialist with pediatric infectious diseases, and I'm here also on behalf of American Academy of Pediatrics in California, representing over 5,000 board-certified pediatricians. We appreciate the Assemblyman bringing this issue to the table. We clearly think that this is important. I personally have treated 2 children this year who have been affected by CMV. I know the benefits of screening. I know the benefits of treatment, but we do believe that the bill as written is slanted towards legislative and policy outcomes, and we've been trying to work with the author's office to address those issues. We would like to see a scientifically evidence-based approach that is open-minded, and we would love to work with that sort of commission, but we've been frustrated with trying to get those changes as written. So we urge your opposition unless amended. Thank you.
Okay, thank you. Others in opposition?
Ryan Spencer with the American College of OBGYNs. We would like to thank the author for working with us, but unfortunately, as it stands now, we are opposed.
Okay, thank you.
Thank you, Mr. Chair and members. Megan Allred on behalf of the California Medical Association. We appreciate all the work that the committee and the author and your staff has done with us on this bill, and we look forward to engaging with you further in this. But as it is written, we must oppose. Thank you.
So please just your name and position. Thank you.
Hi, my name is Dr. Christine Thang. I'm a Los Angeles pediatrician, also with the American Academy of Pediatrics in California, and as stated by the opposition, I too oppose AB 1801.
Thank you.
Dr. Rami Asaf from Los Angeles, also on behalf of American Academy of Pediatrics, and respectfully oppose.
Thank you.
My name is Dr. Alicia Ranadive. I'm also a pediatrician with the American Academy of Pediatrics based in Los Angeles. I agree with the opposition.
Thank you.
Dr. Abby Freed. I'm representing the American Academy of Pediatricians, and I'm opposed.
Thank you.
I'm Dr. Wynn from Los Angeles and part of American Academy of Pediatrics, and I oppose.
Thank you.
Hi, I'm Dr. Avni Vachani, also from the American Academy of Pediatrics, and I also oppose.
Thank you.
Roxana Topete, Los Angeles, with the American Academy, also oppose.
Thank you.
Dr. Chelsea Garnett on behalf of the American Academy of Pediatrics in opposition.
Thank you.
Dr. Daniel Mai, also from Los Angeles, and also in opposition.
Thank you.
I'm also Dr. Schroeder, associated with the Academy of Pediatrics. I'm a pediatrician based in Los Angeles. I also oppose.
Thank you. Is there anyone else in opposition?
My name is Dr. Noor Lawal. I'm a representative from the AAP, and as currently written, oppose the bill.
Okay, thank you. Anyone else? Okay, seeing no one, bring it back to the committee for questions or comments. Seeing none, we do have a, pardon? We have a motion, and a motion by Ms. Aguiar Curry, and a second by Ms. Waldron. I want to give you an opportunity to close if you'd like, Mr. Nazarian.
Thank you, Mr. Chair. And again, thank you for making the accommodation for all the parents that are here with their children and the community that's around this issue. I think we've been working quite a bit with the opposition. I'm glad to see that some of it was removed. And I look forward to continuing working with the opposition. I think the important thing is to put forward a commission with at least some level of a targeted goal of what it is that we even want to study, what is it we want to look at, what potential outcomes we can get, and make it evidence-based. And if we need to refine that a little bit more, I'm happy to work on it. As such, I ask for an aye vote. Thank you.
I want to thank you, Mr. Nazarian, for working with our committee, and thank you for accepting our amendments and your willingness to continue to work with the opposition on this bill. It does enjoy a due pass recommendation from the chair, and I'm going to ask, the motion is due pass as amended to appropriations. The motion by Ms. Aguiar Curry and the second by Ms. Waldron. We'll ask Madam Secretary to call the roll.
Wood?
Aye.
Wood, aye. Mays? Mays not voting. Aguiar Curry? Aguiar Curry, aye. Bigelow? Bigelow, aye. Bonta? Burke? Burke, aye. Correa? Flora? Flora, aye. Levon? McCarty? McCarty, aye. Nazarian?
Aye.
Nazarian, aye. Rodriguez? Santiago? Thurmond? Waldron? Waldron, aye.
Your bill has 8 votes. That's enough to get out of the committee. Thank you very much, Mr. Nazarian.
Thank you.
I want to say thank you to the witnesses who came. I know that a lot of you come long and far, and I know it's not always easy to get around this building. I appreciate that. I appreciate very much you bringing your family members here, and thank you for your testimony today. Thank you so much.